Your period and menstrual cycle can be a super important indicator for your chances of getting pregnant. Today, I'm going to give you all of the information you need to understand your cycle and what it says about your fertility. Along the way, we'll add some tips for you to know if and when you're ovulating and the best opportunities to be able to achieve a pregnancy. To have a baby, the pieces that you need are a uterus with tubes, sperm, and ovaries. And in your ovaries are something called follicles. The follicle is the medical name for the egg sac. When you have your period, your brain makes a hormone called follicle stimulating hormone, or FSH. It tells one of those little follicles to grow big, and all of the others disappear. So every month, a woman grows one big one, but loses the whole group. And then next month, a new group appears. The big one makes estrogen that tells the lining of the uterus to get ready for a pregnancy, and it also tells the brain that the egg is ready to be released. The brain responds with the LH hormone, and this causes ovulation. Ovulation is the craziest part of reproduction. Sperm and egg meet in the fallopian tube, but the tube isn't connected to the ovary. And the end of the fallopian tube has to find that one egg and vacuum it up. And if the egg makes it to the fallopian tube, it will live for one day. If you had intercourse that week and there's enough sperm ejaculated, that sperm can swim to the fallopian tube where it can fertilize the egg. A fertilized egg is called an embryo. And 5 days later, that embryo is pushed into the uterus where it needs to implant. And if it does that, you'll make HCG, or pregnancy hormone, and then you'll miss your period. But if sperm doesn't find the egg, then 2 weeks after ovulation, the period comes. So they totally lied to us in high school. It is not easy to have a baby. The other part to remember is that what brings a woman's period is releasing the egg. If you ovulate, then 2 weeks later, you're either pregnant or bleeding. If a woman comes to me and says, I know when my period's gonna come, I get my period every single month, exactly the same time, then I know for sure she is releasing an egg. A normal menstrual cycle is regular and predictable and comes between 26 and 35 days. You don't have to set your watch by it. And if someone tells me, yes, I get my period every 28 to 30 days, that woman is ovulatory. She's releasing her egg. And she's probably releasing her egg 12 to 14 days before the period came. And so therefore, if you're getting a period every month, you could start to develop a predictive pattern of when you're gonna have your LH surge and when you should time intercourse to achieve a pregnancy. Now, if someone comes to me and says, I get my period, but it comes every 21 days, like clockwork, that's not normal. Even though it's regular and predictable, it's coming too soon. And if someone tells me, I get my period every 2 months, I'm totally regular, every 60 days I get a period, that's not normal. And even though that woman's getting periods, most of them were actually anovulatory periods. When a woman has her period, it's not the egg that's coming out. The egg has already come and gone 2 weeks before. It's the lining of the uterus that's bleeding. And so women can have a period that's not associated with an ovulated egg, but those periods will come at unexpected times. If someone has menstrual cycles that are very wide in range, they come every 60 days, I get 3 periods a year, it barely comes, maybe it's just a little bit of spotting, that woman is not having an ovulatory cycle. And we call this condition oligo-ovulation. This person ovulates less frequently than she should. And there's a number of conditions that cause oligo-ovulation. The most common condition is called PCOS, polycystic ovarian syndrome. And that's a whole different YouTube video on its own. But this condition is made by having 2 of 3 criteria: irregular menstrual cycles, an ultrasound with more than 12 follicles on either ovary, and an increased testosterone level. You don't need to have all 3. We're looking for 2 out of those 3 criteria. And most women will have the first 2. unpredictable cycles, and many, many follicles on their ultrasound. Now, this is not the only condition that can cause irregular cycles. Sometimes it happens to athletes that drop their body weight tremendously. The body thinks that they're not nourished enough to be able to have a pregnancy. Has a different approach than women with PCO, but both of those women have lots of eggs and can be very successful. Sometimes it's not having enough eggs. Sometimes the condition may be related to the adrenal gland, something called congenital adrenal hyperplasia. Sometimes it's related to the thyroid or the brain hormone prolactin. And sometimes it's unexplained. So we call it an unexplained ovulatory dysfunction. Some women get periods every single month at a regular and predictable time, but their periods are severely painful, debilitatingly painful. They're on the floor of the bathroom crying. They're curled up in bed with a heating pad. They're missing work. I'm concerned about that. That's not normal either. Some of these women may have very heavy periods. They tell me, I need both a tampon and a pad. Or I have accidents. I wake up and I've stained my clothes or stained the sheets. Sometimes they tell me that they have spotting the week before their period. Sometimes they may also tell me that intercourse can be painful and they have trouble getting pregnant. When I hear that constellation of symptoms, I'm thinking about a condition called endometriosis. Endometriosis is a condition where the lining of the uterus migrates to other parts of the body. It's not cancer, it doesn't become cancer, but those cells in the wrong place, they can prevent you from getting pregnant. And just like the lining of the uterus bleeds every month when you get your period, so do all of the other places that have endometriosis. And that internal bleeding can be very, very painful. The body recognizes that those cells are in the wrong place and it tries to destroy them. And when it does that, it forms scar tissue. Think about scar tissue like saran wrap, and it can wrap itself around the ovaries. And so even though that woman may grow an egg every month because her period is very regular and predictable, and she releases that egg every month, most likely that egg is getting stuck in the saran wrap, is getting stuck in the scar tissue and not making it to the fallopian tube. This woman also is going to need some help to get pregnant. And there's lots of treatments that are available, but it's a clue for you that you may have endometriosis. So for a woman that has a regular menstrual cycle, when she's trying to conceive, I would encourage you to use an ovulation predictor kit. And this test is looking for your LH surge. Because remember, when you have your LH surge in the middle of the month, 24 hours after the peak is when ovulation occurs. The egg is released. And so you're going to try to time intercourse with your LH surge, with your positive ovulation predictor kit. And when someone has a cycle that's 28 to 31 days, most likely she's having her LH surge around day 14. And after a couple of months of getting data from your ovulation kit, if you have a regular cycle, you don't need to keep doing it. You'll get a sense and you could chart it on your app or your calendar, and then you'll know about the time of the month that you're ovulating. And so typically I would tell people to start being intimate a couple days before. And whether you have sex every day or every other day doesn't make a difference. One is not better than the other. If you have an irregular menstrual cycle, it's actually going to be really difficult to get accurate results from an ovulation predictor kit. So save yourself some money, because either they're always going to be negative or irregularly and unpredictably positive. Ovulation predictor kits are meant for people that have a regular and predictable cycle. While normally, we would recommend someone attempt pregnancy for a year prior to getting help. That's if they are under 35 years old and they have regular periods. If the periods are irregular, sure, you're welcome to try for a couple of months, but I wouldn't spend too long trying on your own because you're probably going to need some help. And it doesn't mean you're not going to have a baby. It just means you need some help. If you have concerns about your menstrual cycle, I strongly encourage you to reach out to our new patient center and schedule an appointment with one of our fertility specialists. I often tell people, if you think something's wrong, you're probably right. And it's just worth an investigation. It doesn't mean you need treatment. It's about getting knowledge and information about what's going on with your body. And knowledge is power. And my goal is to empower you with information so you can make choices for yourself to help you build a family.